All right, once again, warm welcome to you. And today is our 9th experience sharing session of the first exercise for the full learning cycle for the Movement for Immunization Agenda 2030. And we are here, I'm here as always with our guide on the side, Dr. François Gasse. We are already in week 3 of this exercise on situation analysis. And this week you have one goal, you have one focus. The focus this week is to complete 3 peer reviews of your colleague's situation analysis. That is before 11:59 p.m. Friday, the 8th of April, 2022. And to do so, it's very important for you to understand why peer review is essential, and the importance of peer review cannot be overemphasized. You know, it is an important responsibility that we all have and that we entrust to each other during the exercise. Your peers depend on you just as you depend on them. They depend on you to help them to improve upon the quality of their work, just as you depend on them to improve upon the quality of yours. So it's a mutual engagement that we have taken and that we have to honor, knowing that our peers cannot move forward in the exercise unless we help them to do so. That is by giving good quality peer review. And the golden rule for peer review is you write it in a way that you would like to receive the feedback yourself. That said, I would like to turn towards, I don't want to take so much time because we have just 30 minutes for these sessions. We can go up to 45 minutes. And so it's about experience sharing, and the experience sharing is done by you. So that's why I don't want to speak for so long, but I'd like to turn towards our guide on the side, Dr. François Gasse, to invite him to just tell us the essentials, what we have to keep in mind, what scholars need to keep in mind as they do peer review, as far as the situation analysis is concerned. Maybe 3 steps, 4 steps. Thank you, François.
Thank you, Charlotte. I think we've been already doing one session last week, and I think what's very important, the peer review, is you have 3 things. You have to base your review on the rubric for the situation analysis, which is a guide to help the participant to write very well their challenge, the cause of the challenge, the evidence for the challenge, and the sort of baseline data for the challenge, the cause and which one is the most important cause, and looking at the next step. And I think the work of the peer review is to try really to improve and to make suggestions to be as good as possible, the situation analysis. And this is very important. And I think you have to look very carefully at the specificity of the challenge. All people at all levels have many challenges to reach a high coverage, to control disease, vaccination, but you have different challenge. You need to choose your challenge, which, if it is resolved, will make you gain points towards a good coverage, a better control of vaccinatable preventable disease. But for this, you need to to be sure that the writer is analyzing the cause and responding to the cause. He may be able to list the potential cause and may have evidence or not for those cause with quantified data. He may assume that those may be a listing of the cause, but he may need to have actions to confirm the cause and maybe the weight of a given cause. So in your peer review, we expect you to help the person to do the best possible situation analysis as per the guidance made in the rubric. You will see that in your peer review, it's listed. The most important is to highlight something you would like to better understand. It's not to criticize, it's just to highlight something which is not clear enough for you, not specific enough, suggesting what he could do in that section to make it better. So this will, 2 of us, we do better than one alone, not everyone alone. And when you have 3, you start having a team that will help a lot the writer of a situation as this, and considers that this situation is his own situation, it's his own challenge. So just try to understand better the challenge, the cause, and what to do to really assess those causes very well in order to find the solution to overcome this challenge. Thank you. Over to you, Charlotte.
Thank you very much, François. And we are going to go right away to the presentation of a peer review. And earlier on, we already had a volunteer. That's Saeed Amar Hussein Shah. And Saeed, okay, you're already unmuted. That's great. So I'll just go ahead and share the screen so that you may start. And please do remind us who you are and where you're joining from.
Charlotte, is it possible, can I see my comments, which I have reviewed, the second one?
Okay, yes, I hope you are seeing.
Yeah, I am seeing, please enlarge it, my comments for question 1, 2, 3, 4, 5, 6, like this, which I have reviewed, and really I learned a lot. The author has well identified what was the issue. That was the issue of measles rubella to drop out from first. This was the challenge and the factors which were not known to the author. But well, in the summary, he has summarized all those factors that were included. If I can see my comments, please scroll down this. Not this, madam. Charlotte, my review. Yes. Author has well identified the important challenge and questions supported by the compelling explanation of local situation. And the author has fully command on the subject and good analytic skills. From 2018 to onwards, situation was analyzed by the author, and possible efforts have been made to identify the reason of high dropout rate from MR1 to MR2, with the actions taken by the district like Piri, which have positive impact to combat the situation. It is evident at some period of time that has been shown by the author. Second one, please scroll down.
Yes, Saeed, I'm going to scroll down, but can you just briefly present maybe the author's own some of the situation analysis?
Yes, due to shortage. Yes, due to shortage of time, definitely it is not possible to go through all the presentation. In short, the author has well identified what was the issue. That was the dropout rate from MR1 to MR2, and there was a good situational analysis, and there were 22 areas. And in these 22 areas, there were different dropout rates among these areas, and there were different factors like shortage of vaccine, like the accessibility to the vaccination teams, like the armed conflict area, and different reasons he has well described. And in the last, he has also shown this. If you see the graph, what is the exactly in the duration of time when there is a, if you see the red bar is below and the blue bar is above. So it means definitely there is a dropout rate, but he has analyzed well, and he has given the enough reasons, and also he has suggested a good points and plan of action to improve the situation. And really, I learned a lot from this experience, and definitely by this experience, if you see this below, scroll below, please. The below columns, if you see below, scroll below. So he has well described all the factors, what are the reasons and the way forward, and what he is going to do. So really learned a lot from this, and definitely I will implement and I will improve my situation analysis, and definitely all the only one issue was there. In references, he has quoted only one reference instead of two, which I have suggested to go to the idea engine and review the other colleagues and give 3 references. Otherwise, that was marvelous and I learned a lot. And inshallah, I will improve my situation analysis. I have learned a lot from this. Over. Thank you.
Thank you very much, Saeed. François, it looks like this is, this could be a case study of situation analysis.
Yes, Charlotte, I think I totally agree with the reviewer. It's an excellent situation analysis. And maybe in terms of, I think in many terms, because it's quantified data, it's, you know exactly the size of the problem. It's focusing on the information he has available, looking at the DHAS. With, of course, if you see, when you have a dropout, I think we don't care of the population size, at least for the dropout. What we may be cautious is that how many non-vaccinated at all, neither by MRR1 and MRR2, but it's free to choose to go for the MRR, the dropout, as a principle that he has highlighted. So it's very good situation as this. The only, and I think when you look at the action, the corrective action is going to do, I'm a bit, I would ask how, if you had to choose 3 corrective measures, they have to be based on the most important problem, because it's a dream to do everything, but we are limited in time and resources. I think I would have suggested if you had to do 3 of those actions, which are realistic, that he can do with his time available, with the human resources available, and with the financial resources available, I would say, could we make a prioritization? Because this is a dream. So that would be my only kind of additional suggestion, is to make priorities among the cause and priorities among the corrective measure, if you want to list, because he has already done a good situation analysis. Over to you, Charlotte.
Thank you very much, François and Syed. I just wanted to just highlight for those, if you have any comments on this peer review, go ahead and type your comments in the chat or raise your hand if you want to speak. But the good thing is, Syed did not just simply say, excellent, there's nothing to add, but he actually spelled out to the author what he found that was really good about the situation analysis. And that's the whole essence also of peer review. So Syed, as we discussed earlier, I think so far we have not yet had any raised hand to do or comments concerning this particular work. Will you, okay, I'd like to invite Prof. Becky Tagbo. Prof. Becky, go ahead, you have the floor.
Thank you, Charlotte. This is really a very good presentation. I agree with the reviewer completely. And I also agree with François. I looked at, for instance, in the steps, you could see sensors. So we should be thinking of the logistics of our next steps and the feasibility and the involvement, the resources. And so that way we can prioritize, just like François said, and pick the most feasible, doable within the time available to us. So that's otherwise, it's a wonderful, wonderful situation analysis. Thank you.
Thank you very much, Prof. Becky. So as a reviewer, the question maybe to ask the author is, when he talks about population census, what kind of resources would they have to carry this out, some of these actions? Because it could be maybe some headcount during a campaign, I don't know. But so really to be, like François says, feasibility specific, is this something that they can do with resources that they have at their own level? Okay, so thank you very much for that, Professor Tagbo. All right, so I want to invite Said, if there are no other raised hands or comments. Said, earlier on when I put up the first submission, you asked me to go to the second. So, but before I come towards you again, Dayo Ewart has his hand raised. So over to you, Dr. Dayo.
Thank you so much, and thank you, co-host and everybody else. Yes, it's still on the population census. This is in the purview of the National Population Commission, and for the purpose of validating targets for vaccination, it is not the population national population census that is required here, but a walkthrough and households in enumeration. This is done and presented to the national EOC that will have to validate that before they can now adjust the targets for the particular spots. So what the author wants to do here is to do a walkthrough, and that involves community leaders and elders in council, and then health staff and other field workers. They do household enumeration, and they will now present that for the community leader to sign, and all the party stakeholders in the community to sign. Then that will be presented to the national EOC that has the authority to determine targets for RI and other immunization activities in the nation or a particular community. Altering target population is not a very easy process. WHO, UNICEF, other partners will come together with the community, do a walkthrough, and then community leaders, they will have to agree, and they have to be part of the process from the planning to implementation. Then they present that to national EOC for validation, and then adjust. So we may need to use appropriate wordings for what we will do, because population census, as we all know, is done by the National Population Commission, and is not usually not a staggered or isolated counting that is done in that particular case. So thank you so much.
One.
Yes, François, please go ahead. I was about to
a little comment I have is that I was wondering, every area don't show how big is the area, but you develop a micro plan traditionally. Do you have, my question, is there already one ongoing? Is the district, is there already one ongoing? Now, are the challenge being listed and the corrective action already being listed? Or what is the innovation to do better than you have planned for? Or maybe you want to do better certain corrective measures that have not proved to work. I would take an example for MRI dropout will be searched in the community by community health worker. Is this already an ongoing work, or is it a new work? And do you have the community health worker everywhere? Are they being trained to do that, or is it something new you are adding to reduce the dropout? That would be a question I will ask the person who wrote the list of next step. These are the things which are important, is to see if you're going to do better than what, is he going to do better than was planned? Or was it a corrective action that was never so true in the strategic plan? Just to have a clarification.
Okay, so since we don't know the author of the write-up of François, but those are questions maybe that Said could ask in the peer review. And talking about that, I wanted to, before I turn towards Syed Miraban Shah, whose hand is raised, find out François, because here it's about dropout from MR1 to MR2. So if the population census will actually help him to look for the missing children, those who have not received the vaccines, and as well as maybe those who are dropped out, but is it actually in line with the problem that he has at hand, which has to do with drop out, that is from MR1 to MR2, because he may be giving himself actually a lot more work here than necessary. François.
I think it's a good comment. You know, to assess dropout in some countries, they have a tracking file, which may not be in place in your district, where any child who receives a dose is in a file, and for the next dose, at the appropriate months, the form is put in to make sure that those children, and then you see immediately where the children will drop out, and you look at how you're going to catch them by contacting or doing the outreach or whatever. And I'm not sure what's going on today to reduce the dropout in the area. And was this done but not sufficient for any reasons? So it looks like he has a solution using the community health worker, but we don't know yet what's going on about it. Is it something that's not working and is adding an extra activity to track them? Now, when you do active search for MR2, MR1, the side benefit, if you visit household, it's obviously getting the 0 dose of measles as well as the second dose dropout. So you could have two, you could have 2 benefits instead of 1. Thank you, but I don't know. So those are some suggestions or questions for clarification to the person who has written those next steps.
Thank you very much, François. So I'm now inviting Syed Miraban Shah. Are you able to go ahead and unmute yourself? I'm asking you to unmute. Okay, maybe while Syed is trying to unmute, there is this question from Dr. Kazi Abdul Basit in the chat. He says, I've learned a lot from peer reviewing the beautiful work of participants. My question is, can I modify and add more content to my already submitted situation analysis? Dr. Kazi, for now, no, because this week is for peer review. So next week, you should be able to view the comments that your peers left for you for your situation analysis, and then combine those comments with what you have learned, peer reviewing the works of peers this week, and then use those to improve upon your situation analysis before you submit the final version. So you should be able to do that as from next week. I hope that answers your question. And okay, and you're welcome. So one other thing I wanted to add, for those who have already completed, if you have already finished peer review, like Saeed has done here and left very wonderful comments, but after our discussions today, if you feel, Saeed, you feel like there is some feedback that you want to add, there is something that, some more information or some questions that you want to ask the author of this situation analysis, you can go back to your comments and actually, you can come back here and actually add more comments to the reviews. And at the end, once you have added a comment, you click here on save feedback. Once you click on save feedback, the additional comments that you have added will be added to the peer reviews, and it will give a more comprehensive review to the pair. So let me try again to see if we are able to listen to Syed Miraban Shah, whose hand is raised and whom I'm asking to unmute. Okay, so it's still not working. And so right now I'm going to turn back towards Syed. We still have a little bit of time to, earlier on, Syed, you told me, okay, so we have lost, you told me that I should go to submission 2 because it was a very good situation analysis. So right now I want to invite you, Syed, can you share with us the feedback that you left for the peer for submission 1, you know, how he could improve upon the quality of the work. Syed, I don't know if you're able to unmute.
Yes, Charlotte, if I could go to the third one, that was, I can easily remember because the first one I have reviewed earlier which I cannot recall. The third one I can easily, which I have added. If you see, the author has briefly mentioned in the summary, he wrote only poor uptake of COVID-19 vaccine and defaulter. I am unable to defaulter second vaccine. Most probably he want to ask the second dose. He want to say second dose and myths and misconception of COVID-19. And in my comments, if you could see, which I have added, author has briefly summarized the situation analysis about the proper coverage of COVID-19 vaccination. Author has suggested to elaborate the situation in terms of number and percentage of coverage. If it is poor uptake, at what percentage? There are a defaulter of a second dose, most probably. How much proportion of population is defaulter? In terms of percentage, what was the dropout rate from first dose of COVID to second dose? And what are the reasons? Myths and misconceptions have been identified as obstacles. What is the plan of action to cope with the situation? With this feedback I have given to the author so that he could better present the situation more precise and more in terms of percentages and what the exact situation is. And if you see the second section, the comments which I have given to him, can I see the comments which I have added? Scroll below my, this is only one data source has been identified. That was the only one data source, that is the DHIS. It is suggested to author to identify at least 2 data sources for the comparison and answering the questions in more appropriate way. Without the supporting data source, analysis cannot be conducted, situation cannot be understood, and planning and further actions cannot be suggested to improve the situation. So this is my feedback which I have given to the author. And below, this is the, if you see the, scroll below, please, this one. Author is suggested to elaborate more of key findings with data analysis, poor uptake of COVID-19 vaccine and defaulter second dose, need elaboration with reasons and planning. This is the feedback which I have given to the author. And in the fifth next step, he has suggested outreach COVID-19 vaccine and mass education. The feedback given by me was that author has described next step as outreach COVID-19 vaccination and mass education of the community. Author has suggested to give details of these activities like micro planning, possible advocacy, communication, and social mobilization activity, etc., so that for the next step, better we could plan to improve the situation. In the last, he did not add any kind of a reference, though. So, and my feedback, which I have given to him, is author has suggested to visit the idea engine and review some situations as per author's topic for references. So this was the feedback which I have given to the author for this my peer review. Thank you, over Charlotte.
Thank you very much, Saeed, for sharing that. I see Clement Mbaya Mukati, who has the hand raised. Clement, are you able to unmute yourself?
Hello, everyone. Good afternoon. My name is Dr. Clement Mukati. I'm connecting from Botswana.
Mm-hmm.
Actually, the hand was raised before, but maybe just, I don't know if you allow me to make a comment on this one.
Yes, please go ahead. Please go ahead. And then if afterwards you want to share your own, then we are going to do so.
Yes, okay. I have mine also. I can still share. There's no problem. But on this one also, I would like to start just from the beginning. The work from the beginning, the first page. Yes, there.
Look at the review, because yes, I think yeah, we are focusing on, how would you improve the peer review to help the person who has shared his immunization challenge. So is there anything you would add or discuss on the suggestion or the way it was written? What would you add or disagree?
Yeah, I would like to make a comment
Go ahead.
Yes, from the first page, using from the challenge there is immunization hesitancy. To me, I feel like it's not actually, I mean, in relation with the immunization primary health care, which is actually the first strategic priority. I think this should, to me, it sounds like a second priority, strategic priority, which actually is for demand, talking about demand and barriers. The way it looks, I don't feel like it goes to first to the first priority. And as the question is, why are people? Okay, let's go up a bit. The next page. The next page on the feedback. Okay, though if we can even start from there. The first, as my colleague made a comment, the cover note. Actually, here we are expecting us to present to our supervisor what is going to be done for the person or to improve the challenge, to respond to the challenges. And I feel in this part, the first thing will be mentioned, would have shown the data, to show the data to support the request. Poor uptake, default, actually like they are not even answers, because here we're expected to give the answers. This is what we are planning to do 1, 2, 3. And before giving 1, 2, 3 to be done, we need to give to support the data. So this is the coverage for the fact that there is hesitancy. How much? How is the coverage for that area? And from there, I'm suggesting this. So that is from the first page. Maybe I'll leave to other colleagues, because I feel like there are many comments to be done on this presentation. I'll leave to others also to add. Thank you.
Okay, thank you very much, Clement Mbaya, for highlighting that. You know, that it was here is a cover note presenting your situation analysis to the superior. But before we move forward, Becky, your hand is raised. Are you able to unmute? Okay.
Yes, Charlotte, thank you. Thank you very much for presenting this. There is one advice I will suggest. It appears this author probably was choked with time and so just did this in a hurry. So I would advise that during the feedback, when we have all received our comments, it's good to start early in the week, so that you can have enough time. You give it a kind of a priority, but if you keep putting it up, I will do it on Friday, I'll do it on Thursday, then you may not have time. So it appears something done in a hurry. So that's number one advice. Then if you scroll up, Charlotte.
Yes.
Up.
Go ahead.
Can you scroll up?
Okay.
That's on, yeah, on the author. No, the beginning.
Okay, okay.
The top of the page, yes. Now we were told on that title to put a title that has a verb. So you see, this is just 2 words. It doesn't really, it's not so specific to convey what the matter is. It's just immunization challenge, you know. It's too broad, and if he can refine it a little more, it will be better, I think. And then on the cover letter, I noticed even from my own reviews that majority still don't seem to understand what the cover letter is about. I advise also to listen to Rada's video, because he explained this so well. He said you are writing a letter. You know, the previous author did it so well. He said, "Dear Madam," and then he went ahead to describe so well. So, but many of us just come to this cover letter and we just do bullet points. Certainly that is not a letter. So you picture your boss and you are writing to your boss and you want to summarize what the challenge is, what the findings are, and what are your next steps in a brief summary so that he can get a grasp of what the matter is and then know how to support you. That will, if you have that at the back of your mind, then you will write a very good cover letter. So maybe I can stop here for others to talk. Over.
Thank you very much, Prof. Becky. And I see Fam Daniel, your hand is raised. I'm asking you to unmute yourself.
Yeah, thank you very much. Thank you very much, Prof. Becky, for your observation. But I think when you look at the rubric, the tool, it also talk about the cover note that you can give bullet point, just also in the form of summary. So I believe that it is not out of place if the person is able to put it in like an essay form that is summarized well enough. But if you can also bring all the issues out, but in the bullet point, it is also acceptable based on the rubric guidelines. You can also do so that whether it is in the word form or in a bullet form, the most important thing is that all the key issues you want your supervisor or whoever needs to get that document, it is there. So the moment the person sees it, he can really know by just a glance of what is there. He understands what your whole situation analysis in terms of your findings and your next steps. So I think that it's not bad to do it that way too. Thank you.
Okay, thank you both, Fam Daniel and Prof. Becky. Just to say, yeah, the most important thing is actually that when somebody looks at the cover note, they are able to have a clear picture of your situation. That's just what it's about. Whether you write dear sir or dear madam, that's not the most important. The most important is being able to see in at a glance, you know, a summary of what your situation is all about. So yeah, it starts with, you know, what is your challenge? What did you do to find the cause? What are your key findings and what are your next steps? Just like Professor Becky rightly described. So I'd like to turn now towards someone that has not yet spoken. I'm inviting Oneka Scott. Oneka, if you are able to unmute yourself, over to you.
Good morning, everyone. I'm joining you from Guyana, and it's still morning here. Thank you, Charlotte, for conducting this session. I just wanted to make a brief comment on what the two speakers before said and kind of add what you have said. And this is what I noticed when I was doing my review of the situation analysis. And I don't know if anybody felt this way, but when I was doing other people reviews, I kept thinking, oh my goodness, I forgot to put this, I forgot to put that. But the cover note, I'm not sure the speaker before me, he made some interesting points on what the cover notes is expected to have. And when we were completing the situation analysis, those were the instructions given. But when you compare it side by side, you see that when you look at what you are supposed to be evaluating, there's a little bit more information that you don't necessarily have when you're doing your situation analysis. I noticed that, I don't want to say discrepancy, but I noticed that difference, why you can be carried away and why some people will say, oh, the cover note needs not to be in that form, but it needs to be a little bit more explicit and clear. When you're the reviewer and you're looking at your guidelines on what you're supposed to be looking for in the cover note, it's a little bit more. And so what I would suggest that we do when we are doing our situation analysis, again, after we get our comments back, if nobody has made this point already, my suggestion is that you prepare it when you're finished, along with, you know, taking your time. That person who spoke made a very valid point, but you prepare it and then you try to review it yourself based on the review criteria. So you go back as if you were the reviewer of your own situation analysis and you look to see if you meet that criteria. That's just my little addition. I'm not sure if that makes sense to the team.
I would like, Charlotte, can I comment? Charlotte? Charlotte?
Sorry, hi, I'm having connectivity issues.
Yeah.
That's why.
I must say that I 100% support what Oneka said. I had the same problem in getting part one up front. Even if it's written that you should do at the end, I would have loved to have it at the end when I read all the details and see what it means. I totally agree with her. I would move it to the end. But okay, this has been already ongoing. And I think it's a good comment to do to all the reviewers that and to check first the bottom part, all the situation as is before writing the comment, because then you see what's missing as well that you may have missed when you try to put data. When we see poor update of COVID, does not mean much poor uptake. I don't know how high, how low. Defaulters, I don't know how many, and maybe he has the information, but he wrote it first. He wrote the main problem he had. Then, and of course, when you write to your boss, they may think you would like to know and you don't know yet. And you're going to tell, before we act, we're going to do 3 key informants review or whatever, as Farm has done in the past, but maybe more simpler to find out the true reasons why what are those myths and misconceptions. It's important to know them before you try to answer with the right answer and not assume you know what about the misconception, fertility or whatever. So I think, thank you, Oneka, for those comments. I had the same. In my mind, I agree totally with you.
Okay, thank you very much, Francois. And I think seeing that we are already over time, that we are at 41 minutes, we may not be able to take another peer review today, but I would like to turn towards Clement. Clement, earlier on you raised your hand because you wanted to share a peer review. So do we make it a date on Thursday? At at noon, Geneva.
And could Farm, a brief comment from Farm? That I see.
Yes, François.
Is it possible to have a comment from Farm?
Okay, yeah, Farm did not put down his hand after intervening. So yes, Farm Daniel, over to you.
All right, I think the best thing is, what I've realized is that most people, as Prof. Becky said, I believe one of my reviews, the third one, for instance, I realized that the person struggled to put in some point. I believe he was in hurry. I gave some reasons, whether he was in hurry or he really didn't understand the whole concept of the situation analysis. So I believe that we need to have time for it, because I personally started working on it in the first week. That is, put a draft. I actually did all the necessary work on it, like a draft form. So the other week, then I tried adding the fresh and removing other editing so that you could get a good situation analysis. And also, I agree with the other Oneka and the rest that it's better with the cover note. Anybody that sees it should see a summarized findings, and out of the findings, this is what could help the person to know how you can really tackle your challenge, because you are able to get the findings and the next step. So you need to really make sure that to make you to understand the cover note, you should really make sure you do your key findings and your next steps. When you're able to do your key findings and the next steps, you can then bring out and summarize, because your key findings lead you to your next steps. So you can be able to bring out the summary of what you have done, so that anybody that picks it can really make sense and can find the best way to explain. You will make sense and you understand why this is the challenge, and this is the reason why you are stated these next steps to be able to work on them. So I think the best thing is that make sure you leave the cover note, finish everything, then after that, look at your key findings and the next steps to really write an appropriate summary that somebody can really know what you have done. And that is what really, the cover note is what really stimulate leaders and stimulate partners to say, oh, let me even go and read the whole thing, because what you put there should be catchy, attractive, and stimulating. Thank you.
Thank you very much, Daniel. That's very well said, and I can only consider that as being some excellent closing remarks for today's experience sharing session. But I always want to honor our guide on the side, Dr. François Gasse, with the final word. You know, because from the point of view of experience, and also having listened to all of the voices that were raised today to contribute to smooth peer review of situation analysis, I think there are maybe 1 to 3 key messages that you can share with us, François, as take-home messages for today's session. But before handing over to François, if you are having any trouble with peer review, make it a date with us tomorrow at 4:30 p.m. Geneva time for the technical support session. I've just shared the registration link in the chat. So you don't want to wait till 4:30 p.m. tomorrow, and I'm actually encouraging you not to do so. There is a video tutorial by Reda on how to do a peer review, a practical example of a peer review. So I'm sharing the link again right here in the chat, and I encourage you to have a look at that tutorial so that you can go ahead with a peer review. And remember what Prof. Becky just said, as well as Fam Daniel, that do not procrastinate, do not leave everything to the last minute, else you'll be forced to rush. And when you rush, the quality of your work will not actually be what you want, will not be representative of who you are and of the work that you're doing on a daily basis on the field. So thank you very much, everyone who has shared today. And over to you, François.
You know, I've not have much to add to summary, because I think Professor Becky and Farm have really hit the nail with a hammer on the head. I think starting early, taking time. Sometimes I know you're overly busy and you have so many other competing actions that you have to do. So it's important. And I want to highlight that the cover letter has to be absolutely based on the findings. And those findings have to be quantified as much as possible. You may have all the information or part of the information, but I think it's extremely important. Some information are capital, because communication needs to be based on the content that you can do through key interviews of key informants. And I think it's important to highlight, if you need to spend time with your boss on looking on more finding, to tailor your approach, to justify your approach. I think it's important not to simplify the cover letter rapidly, but it has to be based on all the findings and the objective of the action you take for findings. The last point, I think, you know, it may have been in the conception they want to move into action without having all the findings, and then you may waste time and resources. So maybe sometime your next action will be really to dig to find the cause, and then get better prepared to identify the corrective measure that will have a chance to work, because it's based on your finding. Thank you really, Fam, Oneka, Professor Becky, for your intervention. I think you've covered all the key elements of a review. And this, I again want to stress, is a suggestion to the author of the challenge, saying, would it be possible to do this, to do that? It would be better if you highlight this and this, and do it like that. Make some suggestion without too much of a judgment. Your suggestion are the judgment, because you consider those suggestions will help the author of the challenge. And be careful between, at the beginning, also the generic challenge. Thank you.
Thank you so much, François. Thanks again, everyone. Look forward to seeing you tomorrow for technical support if you need it. at 4:30 p.m. Geneva time. But if you don't need technical support, our next appointment for experience sharing is on Thursday at 12 p.m. Geneva time. And I am sure Clement Mbuh will be coming ready to share his experience. Wish you all excellent day, excellent afternoon, excellent evening, excellent night, depending on where you're connecting from. Bye for now.
Thank you, Charlotte, and everybody.
And I'm going to unmute every hand. So,
Bye-bye.
Bye, everyone. Have a lovely day.
Bye. Glad to be here. Bye.
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 Bye. Bye.
Thank you, Charlotte. Thank you, colleague.
Bye,
Merci
Franco.
Charlotte,
Bye,
merci beaucoup
Professor
Charlotte
Becky.
pour la présentation,
Oh,
pour
Daniel,
l'accompagnement.
bye. You've done wonderfully.
Bye bye et à demain.